Hi, my name is Jessica Altman. I'm the director of the Acute Leukemia Program at the Robert H. Lurie Comprehensive Cancer Center of Northwestern University.
Hi, I'm Liz Dannenberg. I'm a former patient of Dr. Altman's, and I'm an acute myeloid leukemia survivor.
Hi, my name is Amanda Williams, and I'm a physician assistant in the Developmental Therapeutics Program.
Liz, can you tell us a little bit about what brought you to medical attention?
Yes, I remember my symptoms were night sweats, first and foremost, and that was alarming because I'd never had those before. So waking up in the middle of the night drenched in sweat. Also a persistent ear infection that would not go away, a sore throat, and sharp pains that ran down the length of my spine. That would wake me up also in the middle of the night. It was pretty much all that combined that I knew something was wrong and needed to see my doctor. So I went in to see her, and she did ran a blood test, and that's when she found that I had what she thought at the time was leukemia.
Your doctor directed you to come to the emergency room because your white blood cell count was so high and she was concerned about your immediate well-being.
Mm-hmm.
And then what happened when you were in the emergency room?
So when I went to the emergency room, there was another blood draw, and it confirmed within a day later my white blood cells increased by another 17,000. And so at that time the physician did say, I do believe this is leukemia, and we're going to need to do a bone marrow biopsy to decide exactly what type. And I was admitted right away. I remember thinking, after hearing this news, and I was not prepared at all, I came with very minimal things to the hospital. And he told me that I was not able to leave, that it was so serious and so severe, we need a treatment as soon as possible. So it was very much a whirlwind. Things were very quick, but I was moved from the emergency room to an inpatient room, and that began my induction stay. So that was a 33-day hospital stay.
Knowing what you have now experienced, is there anything that your doctor could have told you, things to bring, other ways to prepare for a very long hospital stay?
Yes, if there's some sort of, not quite like checklist, but something to say like you will be here for quite a long time, over a month, and maybe like some comforts from home, something like that really did, because once I did receive those, when family and friends brought them, it did make things a little bit easier. So that that would be good. And also, if things were just possibly explained like a little bit more thoroughly in the emergency room, and everything happened so quickly, and they just kept saying, we'll get to it later, like all the questions that I had, it was so anxiety-provoking, not knowing exactly what was going on and just being rushed around back and forth, and so many different doctors coming in. It was just very, very hectic. And for laymen who don't really understand all the medical terms, it really was difficult. So possibly like a little bit more discussion of what exactly was happening to me inside my body would have made me feel a little bit better.
What made you decide to enroll in a clinical trial and not receive standard treatment in the absence of a trial?
Well, not knowing, really anything about it or anything that was happening,
Mm-hmm.
This is what, Dr. Frankfurt highly recommended, thought it would be very good. And I know that there had been good results with so I had cytarabine and idarubicin,
Mm-hmm.
and very good results with the idarubicin. And she had said that because I was young and strong and otherwise healthy, that she thought the chance of me getting into that trial and receiving those chemotherapy drugs would work very well for me.
So Liz, you received idarubicin and intermediate dose cytarabine chemotherapy. You had a bone marrow biopsy a number of weeks after we started the chemotherapy, and you had no evidence of leukemia. I don't know if you remember that moment.
Mm-hmm. Yes, so after I believe it was 1 week or possibly 5 days of that chemotherapy, and then the whole hospital stay was the 33 days,
Mm-hmm.
like I mentioned, but that round of chemo did put me into remission, so that was wonderful. And then I did have 3 rounds of the consolidated
Mm-hmm.
chemo.
Right, so you then went on to receive 3 cycles of consolidation chemotherapy on the protocol. What happened after the completion of therapy?
So after...
What was life like?
Oh, it was great. So I remember the day that you pulled my PICC line out. That was after about 6 months from my diagnosis, and I said, okay, so we're all done. No. After that bone marrow biopsy, no evidence of leukemia. So I pretty much went right back to my previous lifestyle. I had been a high endurance athlete, so cycling well over 100 miles a week, and I was able to get back into that. I actually feel like that summer, after about a year after my diagnosis, I was in the best shape. And unfortunately, about a year after my diagnosis, I started having the same symptoms again. Ear infection came back and would not go away with traditional medicine or typical antibiotics, night sweats, and same exact symptoms. So I had seen my primary doctor, who again, deja vu, did the same blood tests and everything, and I had to come back because the leukemia had returned.
We did a lot of testing to try to understand the riskiness of your disease. We use a lot of things, prognostic features, to understand how likely we think the disease is to go away with chemotherapy alone versus considering a stem cell transplant initially. And your disease was predicted to be among the more favorable types of acute myeloid leukemia. And so while your doctors discussed the role of stem cell transplant, it was not recommended to you. And sometimes the leukemia doesn't always follow the textbook. And your disease recurred about a year or just a year and a couple months after you initiated chemo. And the difference this time is you knew what it was like to have leukemia.
Yes.
Can you talk a little bit about how it felt when the disease came back?
So, yes. The first time with my initial diagnosis, I didn't know what to expect and what was in store. And when the disease recurred, unfortunately, since I had so many, complications during the chemo and just bad things happen, I was immediately, I was devastated, obviously, but I was also expecting to have a repeat of that first 6 months of treatment. And I did not, exactly understand how. I knew there was a chance that it could recur, but I didn't know at the time about my genetic mutation or what exactly caused it. So it was much scarier. I also thought, and I think this is just my own knowledge or what I had thought, that if it relapses, that's so much worse than having it the first time. So I think I was actually much more frightened the second time than the first time.
At the time of your relapse, were there things that you felt the healthcare team could have done to help support you better than what you did experience?
I think there were a lot of questions as to what exactly a genetic mutation is, specifically because it was very unclear to me having the term genetic mutation, but that I didn't inherit it from my parents. And so I guess it was a little confusing. If that could have been explained a little bit better, I guess, or more thoroughly, I think that would have been helpful. And also, I wasn't quite sure why the mutation was not detected at my original diagnosis, and I don't know if it's just advanced testing or if it was. I honestly still don't even know if it was not present at that time. I think that was very confusing for me. So that would have probably been helpful to have a little more explanation of exactly what this mutation is and what else could have been done to find it, discover that.
When your disease recurred, we offer you a standard salvage, what we called salvage at the time, salvage or reinduction chemotherapy, and your disease failed to respond to that regimen.
Yes. That was very difficult. I do remember that. I remember not being able to have any more. I believe it was cytarabine that I had my lifetime max. Was that
the other class of drugs, the anthracycline?
Okay.
Yep.
So I know that I could not have that again, and so it was a different type of chemotherapy. And yes, it did not. I would think I was expecting what happened in my original induction, that it would put me into remission. So that was very difficult to hear. And we had discussed, you and I, when I first relapsed, that there was, possibly a clinical trial that I could participate in. So my impression after, hearing that the chemotherapy did not work for the second time was that that was my only option. was to try this, the clinical trial.
Did you understand the difference between the first clinical trial that you enrolled in and that the second one was an investigational drug?
Yes, so Dr. Altman did explain that to me, that at the time, it was not FDA approved, that it was just, in the very early stages. I was aware that this was like very early stages. And, again, like I said, that honestly really didn't even matter to me because I really thought that was my only option.
I find that interesting that it was that you felt that it was your only option. I'm hopeful that the healthcare team, including me, did a reasonable job explaining that was that there were other standard chemotherapeutic options that you could receive, but we thought that the chance of you benefiting from an investigational therapy was at least as good, if not better, than a standard chemotherapy regimen.
Okay, I see. And maybe I just thought that because the chemo didn't work, and thought maybe different kinds wouldn't work, so it just seemed something different. And
Yep.
yeah.
No, I think that is, in actuality, I think very astute of you.
Can you tell us a little bit about your experience on the clinical trial and how you felt and how you felt your side effects were managed?
Sure. So I remember enrolling in the trial. It was December, I remember that, and I started out feeling very well. And that was a little bit difficult for me to understand because I knew that the chemo didn't affect my disease at all, so I still was very sick, but I felt so well. So that was interesting. But I think that was good, though, going into the trial feeling well. And I did start getting some symptoms pretty early, or side effects, I should say, pretty early on. And I remember headaches that were awful, very, very bad headaches, and nothing really was seen to help those. And then pretty nauseous from the drug as well. Then I also talked to that, I believe he's a palliative oncologist who recommended medical marijuana to help. And that was actually the only thing that worked for getting rid of the headaches and stopping the nausea and relieving the insomnia. So once I started a regimen of that, just a small amount daily, all my side effects went away. So I really felt well like the entire time and felt like myself, and next thing I knew I was in remission again.
So this drug that you are on is AG120.
Mm-hmm.
Has recently been approved by the FDA for treatment of adults with an IDH1 mutation with recurrent disease. And you were a part of that trial that has led to its approval. So thank you for participating in an early phase trial.
Oh gosh, thank you. I know, I was thrilled. Dr. Frankfurt did tell me that, and then I read an article online, and I was just so thrilled because I think it literally saved my life, absolutely. So I think it's wonderful that it's now available and able to help, so many other patients.
Why did Dr. Frankfurt and Amanda and I recommend a stem cell transplant and not just continuing this AG120 ivosidenib drug?
The way I understood it is that because of the IDH1 mutation, my own bone marrow would continue to make the leukemia, so that even if I had more chemotherapy, which put me into remission, eventually the disease would come back and keep recurring. So the best way to prevent that and to prolong my life is to give me the stem cell transplant, which would get rid of that genetic mutation.
And can you tell us about your understanding of transplant and if you felt prepared for what was about to come from, the information that we were providing?
Mm-hmm. I do think I was well prepared for the transplant. I think knowing so far ahead of time that it was going to happen, I had, about like 8 months to really prepare for that. Mm-hmm. I think that was helpful. I think the team that includes a transplant coordinator and a transplant social worker, that was very helpful. And I knew exactly, what to expect from day one. I think everything was, very clearly explained, and it was exactly how everyone said how it went. So I think that was great. What I was not prepared for were the complications, the severity of the graft versus host disease that I contracted. That was difficult.
Can you tell us a little bit about what you experienced and also how our healthcare team can help you anticipate graft versus host disease. I know that your meetings with the transplant physicians and the team beforehand provide a lot of information, but again, just like we're talking about enrolling on an early phase clinical trial, in your opinion, there was not a choice, and so you're going to absorb some of the information and you'll probably not hear a lot of it.
Yes. I think when I was in the hospital receiving my transplant and then staying, I was told to be very careful as far as looking for signs, any changes in my skin, diarrhea, vomiting, things like that. It definitely talked about, but I don't feel like emphasized. What happened to me is I just caught a cold that turned into this severe stage 4 graft versus host disease. So I think if it could be over-explained or just like really beaten to how critical it is that, if you do get a cold, if you get a cough, something like that, how important it is to just get to the emergency room immediately, because that was what, ended up for the longest hospital stay I've had. And it was, like I said, the stage 4 graft versus host disease, and 5 weeks of that initially, I had no improvement. So of everything since my initial diagnosis, I do feel like that was the worst part.
Liz, you've had a very large team of doctors, nurses, PAs, nurse practitioners take care of you. Can you talk a little bit specifically about the role and the relationship with APPs in particular, so the PAs and nurse practitioners?
Sure. In my experience, I became, good friends with you and with Ellen and, the PAs that I have seen, another woman, Melissa, on my stem cell transplant team. I think in these situations, there's so much going on for the patients, and it's really helpful to have, the APPs checking in on my emotional state, how I'm feeling, what else is going on in my life. I think you were so good at making me feel so comfortable and discussing other things and how the treatment affected my social life, my love life, everything, stuff like that, to really make sure that what you were doing was what was best for me all around and not just what was going to, treat my symptoms, anything like that. I think, you being so concerned about just my life in general and wanting me to maintain, as much semblance of normalcy that I could was so helpful. And, especially during that clinical trial when I remember there were 8-hour days, sometimes 10-hour days. I was there for a very long time, and being able to, talk to you really about anything that was going on was so helpful. And I think that made, such a difference. And now, we've become such good friends now, which is great.
I think also in our practice, the nurses and the advanced practice providers are really your first line of symptom assessment and questioning. And I think the ability for them to be on the front lines and address your questions urgently is such a huge benefit.
Yes, I agree. I do find that's a very good point. I found that very helpful. I remember I used to come into clinic with a list of questions, and Amanda would just be like, okay, shoot. And I would just, say everything that was happening, if it was something new or, if we're following up on something. And I do feel like you were able to take care of a lot of things for me and, answer a lot of questions. And that left, Dr. Altman more time focused on what she needed to do. I think how you interact with the patient really works well. Maximizes time, efficiency, all that. And, I always felt like all of my questions were answered, and I think that was really helpful.
Liz, you have been through so much. You were diagnosed with acute myeloid leukemia, had a whirlwind of an experience when you were first diagnosed, as you so eloquently described to us, had intensive chemotherapy with side effects and complications, and your disease went into remission. You had a really nice, wonderful period of time, and then experienced your disease recurrence, which I am sure was a terrible moment. And even more awful was, I imagine, was the feeling that your disease didn't respond to treatment. And then you enrolled in an early phase clinical trial. and had some complications, some side effects, and yet you're persevered, and after a number of cycles of chemotherapy, a number of cycles of treatment on the clinical trial, your disease went into remission. And yet the story was not over. You underwent the most medically intensive procedure that we put people through, and you underwent a stem cell transplant and had significant complications of graft versus host disease. You've been through an incredible amount, and you have maintained your grace through every experience. As one of your physicians, I have learned so much from you about how you're able to navigate such challenges and maintain your inner spirit so beautifully. The relationships that you've maintained with your family and the warmth that you provided to your family and your healthcare providers, even when you felt crummy, was remarkable. Thank you for allowing me to be one of your healthcare providers.
Oh, thank you, Dr. Allman. Thank you. And you too. Thank you so much for
She said it
everything.
in a lot of words. I just want you to know that you were truly amazing, and I don't even think that this highlighted, a tenth of what you really went through all of your treatments, and it's truly remarkable, everything that you've been through, and you're always smiling, always. It's been amazing, to help take care of you and support you through this, and I'm lucky to have such a good friend now.
Yeah, good things have come from this.
Yeah.